Hello, my name is Kevina, one of your presenters on Kevina Talk. Thanks for watching us and welcome to today's video. Micronutrients are one of the main categories of nutrients that our bodies require. Although required in extremely small amounts, these nutrients play very vital roles as far as proper health is concerned. In case of any deficiencies or excess intake, there could be very adverse health effects. In today's video, I would like to talk about what micronutrients are, their categories, the functions, as well as how the body responds in case of any deficiencies. I will begin with a quick recap of nutrient categories. We have two main types of nutrients depending on how much the body needs them. So we have the macronutrients that are required in relatively large amounts, and they include proteins, carbohydrates, and lipids. Then we have the micronutrients. The prefix micro means small, and as the name suggests, micronutrients are needed by the body in small amounts. Nevertheless, a minor deficiency in them could cause severe health effects and can be life-threatening. And these include vitamins and minerals. So let's talk about the vitamins first. Vitamins are organic in nature and we get them from plants and animal food sources. They are categorized into two, the fat-soluble and the water-soluble vitamins. The water-soluble vitamins include vitamins B and C. They are soluble in water and can easily get flushed out of the body. It is very rare to get toxic levels of these vitamins, only if eaten from natural food sources. On the other hand, the fat-soluble vitamins are best absorbed when we eat them along with foods that are rich in lipids, and they can also get stored in fatty tissues for future use. Now, this implies that they could accumulate to levels that are harmful to the body if taken in excess. And they include vitamins A, D, E, and vitamin K. Now let's talk about the minerals. Unlike vitamins, minerals are inorganic in nature and cannot be broken down. They are categorized as macro minerals and trace minerals. The macro minerals are required by the body in relatively larger amounts compared to the micro minerals. They include calcium, chloride, magnesium, potassium, phosphorus, and sodium. On the other hand, the trace minerals are required by the body in relatively smaller amounts. They include iron, manganese, copper, selenium, zinc, and fluoride. Now, we should note that micronutrient deficiency is actually very common. Although they are not a problem in the developed world, micronutrient deficiency is a public health problem in developing countries, especially those in Africa and in Asia, where children and women of reproductive age are most affected. Okay, the other thing to note is that the most common micronutrient deficiencies are for iron, vitamin A, and iodine. Now, for some nutrients, deficiencies manifest with specific signs and symptoms. And some examples here include anemia for iron, which is characterized by general body weakness and a pale skin. Then we have beriberi for vitamin B1, or thiamine, which is characterized by a decrease in muscle function, paralysis, and vomiting. The other one is pellagra for vitamin B3 or niacin, which is characterized by a scaly skin, general body weakness, abdominal pain, and low appetite. The other one is scurvy for vitamin C, which is characterized by bleeding gums. Then we have xerophthalmia for vitamin A, which is characterized by poor vision, dry eyes, and vital spots in the eyes. And then the other one is goiter, which is characterized by a swollen thyroid that manifests as a lump in the front of the neck. Now, what we have to note is that there are some micronutrients whose deficiencies will not show any clinical signs and are therefore very difficult to identify. Now, unlike the deficiencies, micronutrient toxicity is quite rare. Nevertheless, Toxic levels may result if taken from supplements, and especially without the recommendation of a healthcare provider. Now, whether the symptoms develop or not, it is dangerous to take excess amounts of micronutrients. Let's talk about some of the functions of micronutrients. They do perform a range of functions which include energy production, immune system function, blood clotting, growth, bone health, fluid balance, as well as regulation of cell function. The bottom line is that although micronutrients are required in small amounts in the body, they play very vital roles in the overall functioning of the body for good health outcomes. And as such, they should be taken in daily and preferably from natural, wholesome food sources. In case any supplements are needed, they should only be taken with the recommendation of a qualified healthcare provider because any excess amounts could have very severe health implications. Well, if you've liked today's video, please hit that like button and keep it at Kevida Talk.